From CBS 2 News, this is a special report.
Mayor de Blasio is giving an update on the coronavirus pandemic in New York City. Let's listen in.
I'm very, very clear about the fact that social distancing isn't easy. Shelter in place isn't easy. Even remembering to wear a face covering all the time isn't easy. But New Yorkers have done it overwhelmingly and consistently with a lot of strength, a lot of discipline. So we have talked about how that has given us now a chance, having done a lot to get to a stronger place, to go on the offensive, to do the things that will contain this disease further and move us towards a better situation. Now, we've talked about some of the things we're going to need to do. We're going to need to have the most extensive ability to trace people around the city who have been exposed to the disease, to get them the help they need, to get them to isolation if they need that in one of the hotels, all the services that go with that. We've talked about that whole apparatus that has to be built. And obviously the grassroots piece, intensifying our grassroots efforts, more community efforts like the community clinics I spoke about yesterday, fortifying them, strengthening them, helping them with new tools to deepen their work, more and more telemedicine, more and more support and personnel to reach deeper into communities. These are the characteristics of going on the offensive. These are the characteristics of being able to move forward in a coordinated way to beat back this disease. All of these elements matter. But the thing that matters most, and has mattered most since the very beginning, is testing. Not a surprise to any of you. Testing, testing, testing from day one. It's what we needed most. Didn't get what we needed from the federal government. Kept building nonetheless to do the most we could do here. And it is the essence. It's the connective tissue. It's the foundation of everything we're going to do here to fight back this disease, and we have to keep building it up all the time. So let's go over where we are right now when it comes to testing. Lately, we have been citywide, when you combine all the testing done around the city, generally in the neighborhood of about 14,000 tests per day. Now, again, that is much better than where we were, and it shows improvement, but it doesn't show us where we need to get. We have to keep expanding rapidly. Right now, at our public hospitals and clinics, we have capacity for just over 5,000 tests a day across 23 sites. And again, every single one of these tests counts. For the everyday New Yorker, it gives you information you desperately need about your own status, but of course, it is crucial to our ability to fight the disease everywhere, and to lay that foundation for the ability to trace the disease and follow up with each and every case over time. But we've got to get to the point where testing is much more widespread around this city. It will be done in stages, but it's absolutely a requirement if we're going to win this fight to have testing be widespread. So today I'm announcing 12 new health and hospital sites. And these will be expanding over the next 3 weeks, so during the month of May. And let me go through them with you so you see the progression of how these will build over the coming weeks. First, starting next week, week of May 18th, 2 new sites in Manhattan and Washington Heights, in Brooklyn, in Midwood. So when you take where we are today, about 5,100 tests per day in our health and hospital sites, that's going to add another 1,200 or so. That gets us in the course of next week up to 6,300 per day. Then the following week, the week of May 25th, we will add 10 new sites. In Staten Island, 3 sites, Princess Bay, Concord, and Port Richmond. In Queens, 1 site in Woodside. In Manhattan, a site in East Harlem. In Brooklyn, sites in Sunset Park, Bay Ridge, and Canarsie. And in the Bronx, in Fordham Manor and Melrose. So add that into the equation. So again, by next week, we get the sites up. It takes us to 6,300 tests per day. When you add those additional 10 sites, that will add 4,400 tests per day more. Therefore, by the week of May 25th, we'll be at 10,700 tests per day at health and hospital sites alone. So we'll be more than doubling our testing capacity in our public hospitals and clinics. And that is the essence of getting out to the grassroots, but it's only beginning. We're intending to do more and more as more and more testing, more and more lab capacity becomes available. And again, as I said, by the week of May 25th, when you add everything together, we'll be in the range of about 20,000 tests a day. I want to see us in the months ahead get to 50,000 tests a day, and then ideally go beyond that. The criteria for who gets tested will keep evolving as more and more testing becomes available, and we'll have more to say on that in the coming days. But it stands to reason, as we reach deeper and deeper into the city, we want more and more people to participate, so we'll keep you updated on that as we build out our testing program at the grassroots. Now, test and trace. So remember, testing is important for every individual who gets tested and tells you something absolutely vital for yourself and your family and helps you know how to handle the situation you're in. But what we want to do for everyone is build out the tracing element of this, finding out if someone tests positive, who have been the other contacts that they've had, close contacts, who need to be evaluated. In many cases, will need to be tested as well. So the goal here is to trace people, and then for those who do require support and isolation, to make sure that that happens seamlessly. Look, again, some people will be in a situation where they can isolate effectively at home. Other people will not and will need help and will want help, will want a place where they feel safe and where they know they're not in a position to spread the disease to other members of their family or their household. That's what the hotels are for. But I keep reminding people, it's not just a hotel room somewhere, you know, here's an address, good luck. No, it's a very, very deeply coordinated effort. Once someone's identified as needing that isolation and needing that option, to get them there, the transportation to get them there, the medical support once they're there, food, laundry, you name it, all of that has to be put together. It has to be constant. It has to be something that people can access quickly. And when they're done and they're safe, they go back home. And then, of course, there's more people who will need to take advantage of the isolation. So it's a nonstop effort, always having a room available for anyone who needs it. And that's crucial. I want people to be very, very clear about this. We're building out test and trace capacity with the goal of making sure there is an isolation location for anyone who needs it. And we have a lot of hotel capacity that we already control, and we can get a lot more as needed. So we'll build it as big as it needs to be. So as we look at what it's going to take to build something like this, and it's never been done on this scale in any American city before. So when you think about what's necessary, a leadership that can really put together something big and challenging, a big logistical and operational challenge, but also a compassionate challenge, making sure that each and every human being is treated with dignity, with respect, with the support they need. So the team we have been building very much comes from that tradition of knowing how to get things done, but also people with big hearts and big appreciation for what it takes to serve all the people of this city. Folks who come out of our great health agencies and have been steeped in that philosophy of being there for each and every New Yorker. I last week announced the executive leadership of our Test and Trace Corps. We are now bringing 2 more leaders in to build out this leadership further, to oversee the tracing and isolation operations. And each of these pieces is a really big job unto itself, given the scale of this city. So we looked for people who were really good, really talented, really experienced, and could handle the sheer intensity of what we were asking them to do. So first, our new Director of Tracing, Dr. Neil Vora. Neil Vora is someone who since 2015 has served in our health department as Director of Disease Control Informatics, Data, and Outbreak Response. That is a mouthful, but a very important job. And he is someone with tremendous expertise in tracing infectious diseases. In fact, so much so that in 2014, working with the Centers for Disease Control nationally, he literally went to West Africa in search of information on Ebola and literally went into caves in West Africa to learn about the bats who were the carriers of Ebola and rabies. Talk about hands-on, talk about a can-do spirit. Dr. Vora has proven by his actions that he is someone who is going to go out there and get the job done no matter what it takes. He's also overseen New York City's Ebola monitoring and Zika testing coordination program. So he has dealt with tough situations before and brings so much expertise and spirit to this effort. So we welcome him. We welcome Dr. Vora as our new director of tracing. Now, the team he will lead, the contact tracers, their job will be to identify each and every case. Dr. Vora knows from the work he's been doing already as a key member of our COVID-19 response effort that we've got to make sure that that is good and precise work, but then we also have to make sure there's the right handoff to the team that will manage the isolation for all New Yorkers who need it. And so to coordinate our isolation team, the new director of our isolation effort will be Dr. Amanda Johnson. She is currently the Senior Director of Ambulatory Care Integration at Health and Hospitals. Now, Dr. Johnson is not only a great physician herself, but she has built a career on helping other physicians to build their skills, to really understand their patients and everything it's going to take to get someone through the whole process from the beginning of their challenge, their disease being identified, to full recovery. She was chief resident at the University of California at San Francisco, and also there and in her current work at Health and Hospitals, her focus was on teaching residents, teaching doctors to care for the whole person, to care for the patient from beginning to end, to make sure that there was that continuity. And this is so important to the work she will do directing our isolation effort, because remember, we've got to see people through from the moment it's clear they need that isolation to the moment that they can go home safely. Every piece of the equation has to be covered. So Amanda brings that mindset, that history, that experience, also a bonus qualification. She has a joint MBA, MD from Harvard. So her background is not only as a doctor, but also with operational mindset, a business mindset of how to make something big and complex come together. Really rare and special background, a special capacity that will be perfect for this role serving this city. So the isolation team that Dr. Johnson will put together will make sure that people have a seamless experience. And we want to encourage those who need isolation to take advantage of it, to know it's there for them, to know it's free, to know it will be an easy, straightforward process. But again, we're building it from scratch. Not a task for the faint-hearted, but Dr. Amanda Johnson is up to the task. So these two great leaders joining our leadership team in Test and Trace, and everyone is moving quickly. And in that vein, the actual hiring of the tracers is moving rapidly. We have the generals, but now we need the Army, and 7,000 applications have come in so far. And we're still encouraging more because, as I've said, we're starting with a certain number, but this effort is going to grow out. Easily could take us to the 5,000 to 10,000 range. So we want people with public health background to apply, and apply right away at nyc.gov/traceteam. Again, nyc.gov/traceteam. Put your application in immediately. And I have an update today that the first 535 contact tracers are now being trained through the Johns Hopkins University Training Initiative sponsored by Bloomberg Philanthropies. As they complete their training and they're ready to go, those tracers will go into action right away. So this effort is moving quickly. Our goal is to have 2,500 tracers in play by the beginning of June on the field doing this good work. So this has to constantly move, and we welcome more applications all the time. Now, one more important personnel announcement today, and This gets back to one of the big points that we've been talking about over these last weeks, which is the fact that this disease has laid bare horrible disparities that every one of us should find unacceptable, that must be addressed more and more aggressively. And that is something we need to work on in the big picture as we think about how to rebuild this city and bring it back, not the way it was, but better, fairer, more inclusive. But right now, there's also crucial work to do to make sure that each and every city agency is doing everything it can do right now to ensure that disparity is being addressed right in the middle of this crisis. So we've put together a working group of city officials, the Inclusion and Equity Task Force, and we need an executive director for this group who really knows this city, knows our people, but also understands how the city government works and understands how to make change energetically and rapidly. And we have found a great leader to serve in the role of executive director. I'm announcing today that Grace Bonilla will be executive director of the task force. She has been doing an extraordinary job since 2017 as the administrator of the Human Resources Administration. She'll continue in that role, but also take on this important responsibility. Her whole life has been spent helping vulnerable New Yorkers and folks who are not getting their fair share. This is what she has focused on. She is a lifelong New Yorker, born and raised in Queens. She understands life in this city. She also understands the immigrant experience coming from an immigrant family. She has done amazing work before government as well, including as CEO of the Committee for Hispanic Children and Families. And she was one of those unsung heroes who helped us to put together the pre-K initiative. In the very beginning of the administration, we had a senior advisory group in 2014 that helped us figure out how to rapidly put together pre-K, and it was a group that immensely contributed to that success in the first months of this administration. So Grace has done so much, and we are so happy she'll be taking on this role. The goal here is clear. Right now, what can our city agencies do as part of this immediate response to help address these disparities, and then go beyond to contribute to all the thinking, the planning, the bigger changes that we're going to need in this city that we'll be working on over the next 20 months, the more structural change as well. This group of key city government leaders will be with that every step of the way. Okay, let's turn to another topic. And this topic, this is really on our minds, and it really has grabbed us all just in the last week or two. It's sobering, it's bluntly frightening, and I want to say to parents out there, if you're hearing this information about pediatric multisystem inflammatory syndrome and it sounds scary, it does sound scary. I'm speaking as a parent myself. It's something we did not see essentially throughout March and April. This was not something that the healthcare community saw on their radar, and then in the last week or two, suddenly, we're seeing something that's very troubling. And we're combining the efforts of healthcare professionals all over New York City to understand what it is and how to deal with it in this context of the coronavirus. This is obviously, and we'll have an opportunity in the Q&A to talk about it more. We're talking about characteristics that have been seen before, but now are being experienced through the prism of this pandemic. That's what's causing particular concern. So I'm going to give you an update on the numbers here, and they continue to grow, and that's why we are really, really concerned and really want to get the word out to all family members to keep an eye on their kids and act immediately if they see a problem. As of the latest information we have, 52 confirmed cases. So that number has continued to grow. 10 cases pending right now for this city. Of the 62 cases, so the 52 confirmed and the 10 that are still being evaluated, 25 tested positive for COVID-19, and another 22 had COVID-19 antibodies. So again, 25 individual children tested positive for COVID-19, 22 had COVID-19 antibodies. We have lost one child And that has made it even more sobering and even more an area of concern to all of us. But again, what we understand so far from our medical community is early detection, early action makes all the difference here. So again, the symptoms: persistent fever, rash, abdominal pain, vomiting. And if you see any combination, especially be concerned. Dr. Barbeau, I thought yesterday, gave a really great description that every parent could understand, or every family member could understand. If your child is off, if your child doesn't have energy, if your child is not themselves and has at least one of these symptoms, call immediately to your doctor, your healthcare provider. If you see multiple symptoms, even more urgent. We want people not to hesitate here. And if you don't have a regular doctor, call 311 and you'll be connected to a health and hospitals clinician. This is something where the quicker a parent reports it in, the quicker a healthcare professional can evaluate, the more chance of protecting the child and seeing them through this challenge safely. Now, we've also been talking a lot in the last few days about something that every New Yorker cares about, which is helping folks who are homeless, helping them to overcome the challenges in their life and get to a safe place and no longer live on the street. And we're now 1 week into the experience of having the subways shut down in the late night hours for cleaning, and experiencing each night what that means for our outreach efforts to connect with the homeless and bring them in. Consistent results now every single night. Last night, 362 individuals were engaged by our outreach workers, and again, specially trained police officers who work with the homeless. 362 engaged, 211 accepted help. 178 went to shelter, 33 went to hospitals. Every single night we're seeing the same things. High level of engagement, large number of homeless individuals being engaged, the majority accepting help. We've never seen that before. It keeps happening night after night. I'm sure it won't happen perfectly consistently every night, but if the first week is any indication, this is a game changer, and we're going to put everything we've got into making this work, because I think it could fundamentally change the future of homelessness in the city for the better and get a really large number of people off the streets once and for all. Okay, let's now talk about the daily indicators. And this is every day the thing we're focusing on together. All New Yorkers get to see this in common. It's all based on the work you do. Overall, the work you've done has been great, and the indicators have really, really moved over the weeks. But we've got to keep going. We had a really good day yesterday, 3 going down together today. We do not have as good a day, but I'll qualify it by saying where things went up, it was by very little amount, so that's at least something to note. We want them all to go down, obviously want them to all go down consistently. When they all go down consistently, it says something really profound has happened, and that's the gateway to opening up more and reducing restrictions. But today, a little too much of a mixed bag. So indicator 1, daily number of people admitted to hospitals for suspected COVID-19, that is down from 55 to 51, and I always want to celebrate when only 51 people are going to the hospital for COVID-19 compared to where we were a few weeks ago. Look, let's keep celebrating not just the trend lines here, but the sheer numbers when they're this good. That is something really to be happy about. That one went down. Let's keep that going down. Now, on the number of people, indicator 2, daily number of people in the ICUs across health and hospitals for suspected COVID-19. That number went up. It only went up by a small amount in the scheme of things, from 537 to 550, but it still went up. That's not what we want, obviously, and that's a number that's still higher than anyone would want. That many people still fighting for their lives, so we got to see more progress there. And then indicator 3% of people tested positive for COVID-19 citywide. It went up by only 1 percentage point. Again, not what we want, but only 1% up. So overall trend line, very good. Daily results, not yet what we're looking for. Stick to it because we know what you're doing is working. Let's just keep doing it. Let's keep trying to do it better. Few quick words in Spanish. Aunque ya tenemos nuevas armas.
You've been listening to Mayor de Blasio give an update on the coronavirus outbreak in New York City. We're now returning to regular programming on CBS 2. For extended local news coverage, you can stick with our streaming service, CBSN New York.
This has been a special report from CBS 2 News.